Kahnawake and welcome to this public safety update today. Today is August 31st, 2021. Kahsennenhawe dear Yajats here on behalf of the Gonawage Ratitsénhaienhs is Ohén iente. And today I have some important updates to provide from the Council's perspective, and then you'll also hear from Commissioner of Public Safety Lloyd Phillips and the Executive Director of KMHC, Westaway. So basically where we're at is that we're going to be moving toward full implementation of the proof of vaccinations here in the community of Gonawage. And there's a number of reasons why we have come to this juncture. And I have to be forthcoming and honest that at first glance, I was not in support of this, as was a number of members on the council. And after 2 weeks of extensive deliberation with public safety and the public health unit here in the community, I was able to see how the Delta variant is a game changer, and that everything we thought we knew about COVID up to this point, that we have to look at it in a different lens. It's definitely more highly transmissible and contagious. We do have at current 23 current active cases in the community, and since this fourth wave of the pandemic has commenced, we now have 63 total cases that we've seen in Gonawage, which is almost half of the total number of COVID cases since the first 3 waves. So therefore, there are a number of people in our community who we know are not vaccinated. And that's for various reasons. Some, obviously, children cannot get vaccinated if they're under the age of 12. There are people who are immunocompromised who also can't get it. There might be allergies and different reasons of why. And then we also know that there's a population or a segment of our population that just chooses not to get vaccinated. And we understand, everybody has freedom of choice. But with this measure, we really have to look at the protection of the collective because of, like I said, there's a higher transmission rate now. It's probably 50% more transmissible than any of the other strains. And we all have a collective responsibility. In the last 2 months, I've never heard more so that every child matters and that we need to protect our vulnerable population, our elderly, our children. And we know at this juncture, a lot of them aren't vaccinated because they can't get it. So therefore, we ask the public safety and the public health unit to put together a case, I guess, to justify why this is good for our community. Because as I mentioned at the beginning, I was not sold that this is something I would want to see implemented. I see the potential of the divisiveness that it causes, and we already know that we're divided in this community in so many instances. But when it comes to this about, who's vaccinated, who's not vaccinated, that's not the intent of segregating or limiting. It's really about trying to limit the spread of this Delta variant and COVID in our community. I have to take my hats off to everyone, to the task force, to the community, everybody who has followed the directives and measures to this point, because it has always been infringing on our rights and our choices and our civil liberties. But at this point now, I think more than ever, that's the #1 argument that people will put forth first and foremost without looking at, well, what reasons why we should take a measure like this. I don't think it's going to be forever. I hope not. What we did ask was that we could have thresholds, or that we could kind of meander through this, because don't forget, we are supposed to be in a state of recovery. We don't want to revert back to a state of emergency. We don't want to revert back to shutdowns. We want to keep the economy moving. We want people to have the freedom to gather and to be able to do the things that we've come to enjoy in the last couple of months. But now seeing the writing on the wall of what's coming with the Delta variant, if you've been paying attention to the news in other countries, India, the United States, this is spreading very rapidly. And I know it's causing alarm. even in our community. And for those who don't know, I mean, tough decisions have to be made, I understand. But when I heard the pleas from the public health unit saying, taking the phone calls day after day from parents who are afraid for their children, having to hear from children who are now, they can't start their school year because they have to be in isolation for 14 days. I couldn't even stay isolated for 48 hours without practically losing my mind. So I can't even imagine what that's like for young children. So, when we talk about things from our cultural perspective, we always say the collective is more important than the individual. So what we're asking right now is for Gonawage to understand that it's not vaccinated versus unvaccinated, or it's not any group against each other, but it's Team Gonawage against the pandemic. And it's happening everywhere, that there's division and people are, taking up words and violence against each other. And I know Kahnawake is better than that. We always pull together when push comes to shove. They say when the tough get going, the going get tough. And I think I could speak for everybody who has deliberated extensively on this to say, you know what? Yeah, there's going to be a segment of the community that's very unhappy about this, but there's also a segment of the community that's going to be relieved that we could try to curb this, that we could control the numbers, that we can control the spread, and that we could try to protect those that we consider most vulnerable, again, which is our children. We keep saying every child matters. Let's prove it. Let's pull together. Let's understand that this isn't forever, and that this is just one measure in many that we've had to endure as a community. Nobody likes to be told what to do. Nobody likes to be limited in their ability to do things. But if you understand why we're doing these things, at the end of the day, it makes it worth it, because our children are our future. They're our most precious, as well as our elders. They have so much knowledge and history and things to share with us that, when things like this are decided upon, I promise you all factors and all sides of this were considered. Because like I said, at first glance, I was not supportive of this. And I know that in the next little while that Lloyd and Lisa are going to show you some statistics and numbers, and it's not meant to be a scare tactic. I have to be clear, we're not trying to scare people. We wouldn't be doing our due diligence and being responsible if we didn't show the community what we see. And, I feel like we're damned if we do and damned if we don't. Because, like I said, I know there's going to be a segment of the population in our community that is going to be very upset about this. And that comes with the territory of, having to make tough decisions. When you're in government or when you're in these positions, to have to make tough decisions, it's a thankless job, but somebody has to do it. And I would ask that, you take into consideration all of the hours, time, energy, and effort that these teams that have been assembled on behalf of the community of Gonawage have done to try to protect this community. And to date, we haven't had any COVID-related deaths to our understanding, and we want to keep it that way. So with that, I just wanted to say, it took the council many hours to consider all things and all perspectives and all voices in this community. We didn't come to supporting this, I'll say, a rough shot or very quickly. We really had to consider, and I hope that with the information that is presented to you, you'll also see the rationale that the Delta variant is something very different. We've been saying it's a game changer, and that we have to do our best as a collective, and each of us as individuals. Like I said, this isn't trying to force you to do something you don't want to. If you don't want to get vaccinated, that's your personal choice. But right now, this is what we feel is going to help mitigate the spread and risk of losing any life in our community. So I hope that we could stand together and stand united, because that's what Gonawage does when we're pushed And this is definitely a test for all of us as Gonawage. And, you know, I don't know where things are going to go in the future. You know, we were able to meander through the last 17 months the best we could, but knowing that, you know, we're all in this together. So that is the message I wanted to bring forward today, and that, you know, just really absorb the information and understand that we didn't take this decision lightly. So without further ado, Lloyd Phillips, Commissioner of Public Safety.
Thank you very much. I appreciate your words and your support, and I really glad that you know, you're here today to again to show that the community that you know, there's much thought that goes into what happens you know, behind the scenes and not just in front of the camera, and that decisions certainly are not taken lightly by no means. And this is not just for this recent decision, but certainly decision since March of 2020. Now, obviously today we're here to provide an update on the overall situation, and Lisa will get into a lot of more rationale, some stats, and a plan moving forward in great detail. She'll be here in just a few minutes, but I just want some overall maybe comments, you know, prior to that, to maybe repeat some of the stuff that Grand Chief had mentioned, but also a little bit from my perspective. Yeah, we're talking about the proof of vaccination is something that's going to apply, you know, across the board in our community. Again, not taken lightly, because we do honestly and truly believe that this is the best way forward, and it's a perfect balance between health and safety and ensuring the economy can keep moving forward. Last week when I was here, I talked about some of our guiding principles. You know, principles that have been guiding us, you know, throughout the pandemic, but then modified slightly because of the fourth wave. But I think it's important just to repeat those, because what we've been guiding our principles and our objectives, you know, first and foremost, from the beginning, it's been to save lives, you know, to minimize hospitalization and death, to protect the most vulnerable of our population, immunocompromised, elders, and now that also includes our children. It's about maintaining the economy and keeping businesses open. It's to minimize the mental health impacts on our people, to decrease people in isolation and feeling isolated, you know, and able to maintain people to gather together with their family and friends. It's to protect the hospital and the frontline workers, keeping cases to a minimum, ensure our education system operates, and have our children on site, in school for this year. Also to ensure that physical activities and sports are maintained, recreation both inside and outside the school. You know, looking at the collective versus individual, and moving towards a state of normalcy is still our goal. And we want to use the most minimal measures as possible to achieve these goals. So this latest perspective, this latest decision was put together and decided, you know, purely from a health and safety perspective, because it supports those principles I just covered. It is part of keeping the economy open and protection of our children, and supports keeping education open and a way to continue to move forward. As Gus has mentioned, there has been a lot of debate in the community regarding this latest measure. Initial announcements were made over 2 weeks ago, and since that time there was much discussion. But the end result is that this is an important piece of the puzzle. It's not the end-all, be-all of all measures, but it's something that fits in its place to help minimize the spread of the virus in our community, especially now that we know that the Delta virus has taken root amongst us. You know, people have asked some of the questions out there about Why does it have to apply to everybody? Why can't we just apply this to non-locals? Well, again, as was previously mentioned, since mid-July, we had 60 cases of Kahnawà, over 60 cases who have contracted COVID-19. And since March of 2020 to July of 2021, we had a total of 134 cases. So you can see in just about 6 weeks' time, we have reached nearly half the amount of cases in a very short period of time than we've seen throughout the entire pandemic. So it is a real threat to our community, and we have to take actions, to mitigate that threat, because our people are getting the virus. And the more people who get the virus, the higher chances of somebody becoming sick, and which is the higher chances, unfortunately, of somebody dying. So we have the responsibility to take whatever steps are reasonable to mitigate that threat to our people. We're not doing this because Quebec is doing this. As was said, no, this is not about jurisdiction or about politics. Like I said, it's purely a health and safety measure. Gonawage had a choice. We could say, no, we're not going to implement this measure in the community. And that would have been solely a Gonawage decision. But if you look at the science behind it and the rationale why this is being put in place, it makes sense. And after the great deliberation, again, that was the decision that was made because it supports, again, our principles and it supports the collective. No, we also didn't want to have a situation in our community where if this was not implemented, then we could highly likely have a lot of people coming from outside Kahnawake who are unvaccinated to get around the rules of Quebec to go to our local establishments and who are unvaccinated. Having a large amount of unvaccinated people coming to Gonawage is something I do not want, and I'm sure that you don't want either. So this is another rationale for taking this measure. Now, people can download the app that's currently available at the App Store, Vaccination code, use that as one measure. But there's also the paper proof that many people already have and have downloaded and printed, or the papers that are given to you when you get your vaccination as proof of vaccination. So it's not simply just using the QR code. Other means of proof are going to be also acceptable. I understand that not everybody supports this, but as I mentioned, we have an obligation to take reasonable measures, to keep our community safe. We have to remember that our youngest are still not eligible to be vaccinated. They don't have a choice, as well as many of the immunocompromised and the elders are still at risk. We cannot forget that as well. But the more we keep our people safe, the more we keep adults safe, the safer we keep our children. We want to keep them in school this year. That's the goal. No promises, but that's the goal. Because it'd be detrimental to everybody's mental health and mental well-being if they have to change. So we have to, again, take whatever reasonable measures in place to keep them safe. And the school system is taking additional measures for this year. We ought to keep them safe. Because as Gus mentioned, every child matters. At the end of the day, it's a very simple equation. Less contacts with COVID equals less cases of COVID, equals less chances of somebody becoming seriously ill, and less chances of somebody dying. So if we lessen those contacts, and that is the key for us to remain safe as we possibly can. And the opposite is true. If we don't take steps to address the Delta variant, the opposite could be true. Increased case, increased risk, increased chance of death. So, and some of these things are not new. We're going to maintain the masking and the distance and the hygiene, and we'll use the least amount of measures required to achieve the goal, as I previously stated. Now, over the past year and a half, we had the task force, And then after the state of emergency, we had public health and public safety doing whatever we can to bring information to the community, and being this platform and many others, educating the community on the current state of affairs and educating the community on COVID and on Delta. And putting measures in place to keep everybody as safe as possible. You've seen our principles. They're here in front of me again. Saving lives, protecting the most vulnerable, maintaining the economy, minimizing mental health impacts, protect the front line, keeping cases down to a minimum, collective versus individual, trying to stay on a course of return to normalcy and not revert back to a state of emergency. These are our core principles. And if you don't agree with these principles, that is fine. But those are the principles that guided us since March of 2020 and will continue to guide us moving forward in the coming months to ensure that we properly address the issue of this pandemic within our community. So I'll leave that with my final words. Lisa's up here to speak to you about some of the latest stats, information and some further rationale, as well as a plan moving forward on how we want to navigate the pandemic in the coming weeks and months. Nyawagoa.
Thank you. I'm going to do my utmost today to give you as much information as and to provide the rationale and a summary of the discussions that were had over the past few weeks in the hopes of giving you facts, data, science, so that you can then make decisions as well for yourselves, for your own safety, and for the safety of those you love. We'll start with the guiding principles and objectives. They were mentioned by Grand Chief Sky Deer. They were mentioned by Lloyd. We're going to show you a chart, and I'll go over them once again. This fourth wave, to start off before I talk about this chart, this fourth wave is different than anything we have seen before. We saw it coming in the countries around us. We saw it heading towards us, and at a council meeting the other day, I think Kahsennenhawe mentioned a tsunami. We saw the tsunami coming from far away, kind of the way we did the pandemic last March. And we had a warning. We had an early 2 outbreaks related to the Delta variant that showed us very quickly what we were in for and how we needed to respond quickly in order to save lives and to continue on this path to recovery. That warning for us was the start of preparation and reinforcement and armor. And this was when the initial announcement was made about moving forward with proof of vaccination measures. Since that time, we've had to really work hard at documenting, analyzing data, looking at the science, having open, honest, difficult discussions throughout the whole time in order to come to some decisions and conclusions about how we need to move forward. And part of that is developing a whole new plan. So kind of keeping all the great things that we've learned over the course of the last year and a half about masking, distancing, hygiene, environmental measures, all the wonderful things we learned about family, connectivity, togetherness, teamwork, collaboration, maintaining all of those things, but starting fresh and figuring out how do we manage now. Over the course of the summer, we managed to go back to the old normal when you really think about it. We had a bit of a reprieve, and that was difficult, especially now because we're going backwards. But are we going backwards? Not really. It feels that way, but we have to change our perspective about where we're going. We're actually moving forward. We're finding a way to live in the midst of this pandemic. This pandemic is impacting the world, but we can survive it by finding a way to live and move forward, despite the fact that COVID may be around for many years to come. How can we do that with the least amount of measures? How can we do that with respect? How can we do that while keeping kids in school, while maintaining economy, by protecting our mental health and well-being, our relationships, our community? There's a plan that we have in place that we want to show to you today. So we'll go back to that chart. Sorry, Wanadio, I messed you up there. So the first thing we want to look at the bottom of this, again, are our guiding principles, our objectives. And I'm going to repeat them because they're worth repeating. Save lives, minimize hospitalizations and death. Protect the most vulnerable, whether it be our children, elders, those who are immunocompromised, those with chronic health conditions, those who could not survive COVID. Minimize impacts to mental health. How do we know that we need to still gather? We know we need to see our families. We know we can't be isolated. We know how detrimental this was to everybody. We need to protect our hospital, our frontline services, our mental health services. These are our community organizations. These are all community members working for the community. We need to protect them from burnout. We need to allow them to continue to do their job. And we have to protect the hospital systems around us who provide important services and care to all of our community members in times of need. We have to keep cases and contacts to a minimum to be able to do this. COVID is going to be here. We will have COVID cases. That is not the issue. But we need to protect those who otherwise would be very sick from it. We have to ensure education. Our children have been out of school for a year. We want to keep children in school on site. That is a main goal of the Education Center this year. That's a main goal of the community. We want our children and our teachers to be as safe as possible so they can do what they need to do. Ensure physical activity, use minimal measures, again, collective versus individualism, and we want to continue to move forward. To do that, we're proposing several factors, but they would fluctuate in different levels over time. So actually, I'm going to change the order a little bit of the presentation and go to the plan, and then we'll come back to that original chart. So the fourth wave plan is on the screen in front of you. Here it will be in a second. So we have green, yellow, and red. Wanadio, do you have the second chart, page 3? Yeah, that's the one. Thank you. So Kahsennenhawe mentioned that she hopes these measures are not forever. That is definitely the intention, that they not be forever, that we fluctuate through various levels of measures and various understanding of measures and collaboration, depending on the level of risk that we're in at any particular moment in the community. So as I mentioned, we have to learn what the new normal is. The new normal means that we're going to fluctuate between high levels of risk, where we have many cases, many contacts, and a lot of risk for vulnerable populations. And then we're going to fluctuate back to low levels of risk, the way we saw this summer, where we can be a little bit more free. So the idea is that people understand when we're in which level of risk, so what level of risk we're at any particular moment, so that you can make individual decisions to protect each other and to protect your loved ones. So when we're in the green, we're at 0 to 5 cases. This means that there are less than 15 contacts in isolation. Number of cases is no longer a sole measure to use for level of risk, because with this new variant, we expect to have more cases of COVID. However, the number of contacts that a person has, and whether those contacts are vaccinated or non-vaccinated, has an impact on our level of risk. When we're in a low level of risk, we would like to remove the measures that exist that we are going to implement over the course of the coming week, so that we can be as least restrictive as possible. And we would go back to our regular measures of always being careful, distancing, hygiene, masking. Once we have 6 to 20 cases and 15 to 45 contacts in isolation, we bump up the level of risk, we bump up how we have to act as individuals, how we make decisions for ourselves. Oh, we're in yellow. Instead of having 10 people in my home, perhaps I'll have a little bit less. Just knowing the information, having the knowledge will give you the ability to make those decisions. At this point, at yellow, this is when the proof of vaccination measure would kick in, and over the course of the week, we'll give you more details and information about how that will work. And depending on our analysis and our case contact tracing and the information that comes out of that, there could be additional measures in certain risk areas. And then red. So red is when we're at high risk level. This is 21 or more cases, more than 45 contacts in isolation. And at this point, this is a time for the community to really band together and work together to get back to that green. And therefore, there could be additional measures or restrictions on gatherings, larger gatherings in outdoor settings, some recommendations for indoor settings, for sports, recreation, etc. At the present time, we are in high risk. And part of that is looking not only at number of cases, number of contacts, but also our ability to identify cases, contact trace, and isolate. We have to be able to do this between 24 and 48 hours max to be able to decrease the amount of extra cases that will come out of an original case. Vaccination rates are important. Again, Kahsennenhawe spoke very well. Whether you're vaccinated or not vaccinated is not what's important. The choice is yours to make. However, how we respond to those choices in order to ensure collective safety is what matters. And so having the information allows us to make proper, informed, medically based decisions. So the idea is that we fluctuate over time, and we don't know for how long this will last, but over time between green, yellow, and red, depending on these variables. I'm going to talk to you a little bit, I'm going to go back a little bit to the guiding principles and the objectives chart, because at the present time we are in red, and some of the elements that we will be implementing over the course of the coming weeks are highlighted in this chart. So what we spoke about today is the fact that the proof of vaccination measure will go into effect. That is in red at the top, and it'll go into effect in very specific high-risk, non-essential settings, meaning areas, not the market. This is really for non-essential, high-risk settings where we have a risk of mass transmission, such as festivals and events, such as restaurants, for example. We also will have mandatory vaccination in certain settings where there are very vulnerable populations. KSCS has announced that this will be implemented. KMHC is in the process of looking at implementing this measure as well. Other organizations within the community are in the process of evaluating these mandates as well. These will be organizational decisions that will be made by the executive directors of the specific organizations. Contact tracing. This is of utmost importance, as I mentioned, in being able to contain the virus. What this means and how you can participate in this, how you have control, is to provide the most accurate information to our public health team as you possibly can. We need to identify cases, contact trace, and isolate people as quickly as possible in order to contain transmission of the virus. All of our safety measures, this is the part we already know, we already have this, we're experts. Distance, hygiene, mask, well-being, vaccination, teamwork, collective vision, all of these elements working together will help us go from that red to yellow to green so that we can release some of the measures and go back to our new normal. Again, knowing that there may be a time where we fluctuate and move from throughout the phases and where we have to buckle down again together. It's going to be a while before COVID is completely gone, so we need to continue to work together to get through this in a way that makes sense and a way that respects our ability to remain in school, keep our businesses open, save people's lives, and still have life where we are together. So I think we may be having more technical difficulties. No? Okay. Just to mention that these green, yellow, and red, this is a new plan. These colors do not represent the colors that we had presented to you in phases 1, 2, and 3, because as Kahsennenhawe had mentioned, this is a game changer. The Delta variant is new, and we are in the recovery phase. We are no longer in a state of emergency. We don't want to go backwards, we want to move forward. And this is our way of being able to move forward, continuing to move forward despite the fact that that COVID is still amongst us. So I'm going to now give you some of the data that we presented and discussed at length with the council table. And we were very thankful to have the opportunity to do so. So I first want to talk about vaccine efficacy. There's been a lot of discussion about vaccine efficacy, so I want to give you some of the data, and we do have a document that we'll be putting online so that you have access to all the links of where this data is coming from. So mRNA vaccines, Pfizer and Moderna in particular, are 60 to 80% effective in preventing COVID-19. So according to the Quebec efficacy data, they're effective at preventing hospitalizations by 98%. Recent data from the United Kingdom and Ontario suggests lower efficacy against the Delta variant after 1 dose, but efficacy rates increased significantly to 90% after 2 doses to protect hospitalization and death. This is very important. I don't know if we can show you this chart, and I want to just show some of the Quebec data. And again, this is not about vaccinated versus unvaccinated, but we do want to show you that vaccines are working, and we want to demonstrate why the measure is being implemented. And some of this data explains the science behind this decision. So if we just look at the data in Quebec, and this is from a La Presse article, so I'm sorry it's in French. We weren't able to get this comprehensive document yet in English. However, our great communications team will be working on it. So if we look at the vaccination status in Quebec of all of the new cases of COVID-19 between the 30th of July and the 26th of August, what we're seeing, and this is by 100,000 population, 250 people are non-vaccinated versus 30 who have been doubly vaccinated. So there's a significant difference in your risk of getting COVID-19 once you're a contact of a positive case when you are unvaccinated. Your risk is significantly higher than if you have been fully vaccinated. So yes, you can get COVID if you're fully vaccinated. We have always stated that that is the case. Vaccinations are not 100%, and so they're effective at 60 to 80%. Less the older you are, less the more chronic unstable conditions that you have, or if you are immunocompromised, they're more effective the younger you are and healthier you are. In the second chart, and again, this is Quebec data from the 30th of July to the 26th of August, hospitalizations of non-vaccinated individuals represent the majority of the new cases that have been hospitalized, whereas people who are doubly vaccinated are the extremely, extremely low risk of being hospitalized. So this is data that we're seeing throughout Quebec. But what's important is the analysis that we've done also of our cases up to date in Gonawage. So I'm going to present to you a little bit of that information. First of all, I'll just review our statistics. Thank you, Anadio. I don't need this table any longer. So I'll just review the statistics. They're a little bit different because we have new cases all the time. So again, it's true, the first, second, and third wave, we had 134 cases. The total number of cases in the fourth wave, we are now up to 65 total. And our public health team is receiving results on a daily basis, and we do have increased numbers all the time. So we're at 65 total cases, again, which is almost half of what we've had in the first 3 waves. It's normal to have more cases because, of course, our measures are less restrictive. We're on the path to recovery. We expect to have COVID cases. What's really, really difficult at the present time is the amount of contacts. The amount of people who are, the amount of children who are in isolation, the amount of groups that have been impacted through various measures, like sports teams, for example. So how we're really starting to analyze how gatherings in unprotected settings is having an impact on our number of cases. So our fourth wave began July 12th. We're now the end of August, and we have, as of today, as of right now, 22 active cases. Some have been released from isolation, and therefore our numbers have gone down. So we're at 22 active cases. The Delta variant, as we mentioned, is a game changer. How it transmits, how the severity of the impact on us is different. So we're going to show another graph that Justice prepared just to try to explain transmission regarding the Delta variant. Yeah, perfect, thank you. So what we know about the Delta variant, the original strain in the first 3 waves, 1 positive case could infect 3 to 5 people, and that's the graph that you see on the left-hand side. If we look on the right-hand side, 1 infected case or one COVID-19 case can actually infect up to 15 people. And if we don't identify these contacts and isolate these contacts within those 24 to 48 hours, then there is the potential that they then can infect 15 more people and 15 more people and 15 more people. You're going to see also that the Delta variant is more transmissible. Therefore, if you are a contact of a positive case and you're unvaccinated, your risk of getting COVID-19 is much higher than it was during the first 3 waves. So we're going to talk about that. Your risk of infection and hospitalization is significantly higher as well with the Delta variant. For these reasons, we have to have extra measures in place. So I'm going to show you some data from, specifically from our Gonawage testing site. So the next chart is the circle chart. So we're just looking at the data from July 12th to August 28th. So it's of the 56 first positive cases. So if you look at this chart, everything in blue is the number of unvaccinated people that did contract COVID after being in contact with a positive case, and that's 93%. So 93% of our 56 first cases were unvaccinated. If you look at the gray and the orange, these are the 1 dose and the 2 doses. So at this moment in time, when we were looking at on August 28th, 1 person who had 1 dose had contracted COVID after being a contact of a positive case, and 2 people who had 2 doses had become positive after being a contact of a positive case. So we see the representation of unvaccinated versus vaccinated and your risk of becoming positive if you have not been vaccinated. So this explains a little bit about risk level. As of today, these numbers were as of August 28th, so as of today, I just want to say that of the 65 total cases that we've had, one person was an individual that had 1 dose of the vaccine, and we have 4 people who were doubly vaccinated. Still, the risk level is very low if you've had both vaccines, and this explains a little bit about differences in measures when we do contact tracing. This is important information. At the present time, with the data and the science that we have, if you are a contact of a positive case and you are doubly vaccinated, it's true. You do not have to self-isolate. You have to self-monitor for symptoms every day. But your risk is drastically lower of getting COVID-19, and that is the reason why you do not have to self-isolate. The risk is very, very low. So just to show a little bit more about what we mean here, I'm going to show you another chart. So our public health team, what we did was we analyzed and this is data from the first 42 cases. So it's not all 65 cases, we haven't done that yet, but the first 42 cases of the 4th wave. So we analyzed data from all of the contacts of our positive cases, whether they were vaccinated or not vaccinated. Something we do differently in Gonawage is we send everyone for testing no matter what. And this is really positive because it doesn't only give us information, it ensures that when we don't isolate vaccinated people, that they are not positive at that moment. So we analyzed all of the contacts of the positive cases. All of these contacts were all at the same level of contact, so moderate to high risk contacts. And we analyzed the information afterwards of these contacts, whether you were vaccinated or unvaccinated, what was your risk of developing COVID? So if we look at the chart on the left, what we see is that of the 110 contacts that were tested, 53 were not vaccinated. Of those 53, almost 74% of them became COVID positive within 14 days. 26.4% did not become COVID positive. Now, of course, this is a small sample size, but if we look at the Quebec data and we compare it to the data here in Gonawage, we see that if you are unvaccinated and you're a contact of a positive case, and this is the Delta variant, then you are 74% likely to get COVID. And that's in comparison to the chart completely on the right, where we have people with 2 doses. They were 6, and so this is 35 people. Of the 110 contacts, there were 35 people doubly vaccinated who were tested, and only 6% of them became positive. This 6% did not transmit the COVID virus to any other individuals. They were isolated in time, they were self-monitoring. So this is the data from our first 110 contacts. Of course, like I said, it's a small sample size, but it gives you an idea of the trend and of the fact that vaccinations are making a difference. And they're just a part of the bigger picture. We do have people who are vaccinated, we have some that are unvaccinated, and the measures that we're recommending are to protect all of us, to protect the collective. The Delta variant. Now, for whatever reason, and we'll talk about our risk level in Gonawage, but for whatever reason, the Delta variant has taken hold here more than anywhere. We have higher numbers of Delta variant than in any of the regions surrounding us all throughout Quebec. This means that we are at high risk, because as we said, the Delta variant is more transmissible, it's more severe. We have a responsibility to protect each other. Let's look at our vaccination campaign and where we're at there, because many of you have been asking for current, more up-to-date numbers. Just a reminder, the goal of the vaccination campaign is not to eradicate COVID. We cannot do that. But we can protect our community from severe illness and death. We can protect our hospital systems by limiting the rate of transmission. And we can And I just want to explain that because many people ask me, what does that mean, protect the hospital system? Why is KMHC having such difficulty in keeping up with all of that's happening right now with respect to the pandemic? So as you know, during the pandemic, we had to create extra services and responsibilities within KMHC and within public health. That's the testing site, that is our public health team that does contact tracing and reaches out to each and every one of you, as well as the vaccination sites. This above and beyond our regular responsibilities to provide you with medical care, public health information, regular public health, and also we have our inpatient. Our inpatient team at KMHC has really had a lot of difficulty because of the extra measures that have had to be implemented and that they've had to follow and ensure that are kept in place to keep the residents safe. So all of this combined has created a huge strain on all of our staff. Those who aren't working in those specific areas have either added extra hours, have moved to different locations, have beefed up the way they do their work, so the way they clean or the way every single person has contributed. And I'm talking about KMHC today, but of course all frontline workers. But specifically at KMHC, we're a small team. As soon as we identify new cases, we have to identify contacts. Remember, within 24 to 48 hours, we take that responsibility seriously. And to be able to do that, if we have hundreds of contacts to call, we cannot possibly get a hold on this. And we're at that place right now. When we say red, it's because we're barely able to hold on. We're barely able to get a hold of all of you to limit transmission. And we see that we're on the verge of losing control. We can't get there. And we need to protect each other so that we can continue to do the work we need to do. And you need to do the work you need to do so that we're working together as a team to get back to that green area that we spoke about. Vaccination is just a little part of the puzzle. So if we look at our rates, our 12 to 15-year-olds who have had 1 dose and 2 doses, in fact, are at 67%. So everybody who came in for their first dose came in for their second dose. That's really great news. We need to increase those numbers if we can for better protection of our children, but still happy that the 2 doses at least were given to all those who had their first dose. 16 and 17-year-olds, we always say that they're a shining star. They're at 89% for 1 dose, 75% for 2 doses. So remember, in the face of the Delta variant, your efficacy against the Delta variant increases to 96% after 2 doses. So for those who are the 14% who are still haven't had your second dose, please call KMHC to get that. 18 plus, 79% of our population has had 1 dose, 69% 2 doses. Again, we're still open. We receive calls every week. We actually have a vaccination clinic at KMHC scheduled for Friday. We have 8 vials of Pfizer, 48 doses coming in, and we are booking appointments weekly for vaccinations. Again, considering the Delta variant, considering the data that I showed you, vaccinations work, but other measures work. And it's a combination of all of these measures together that protect us. Your choice is your own to make. We will all work as a community to work together to provide safety, whether you're vaccinated or not. And that is what's really important. So what's our level of risk at the present time? Why is Gonawage especially at risk compared to everywhere else? There are a few things that make this community unique that I know you're already aware of, but I'm just going to speak about them again. The first is our travel. People from the community travel a lot, cross-border travel, trips, vacations. That's okay. We want to maintain that, but this provides an extra element of risk that we need to mitigate in our measures. The fact that we want kids to be on site. School reopening will create more contacts. So in order to allow the kids to be in school, we may need to lessen contacts in other areas. This is okay. This is part of the plan. This is what we want to do so that kids can be in school and on-site learning. We know that there's fatigue all around us. All of us are fatigued. And it's not about following measures 100% and always doing the perfect thing. It's about doing your best in your particular situation. It's about doing what's right and what works for you and your family and your loved ones. The change in weather is going to lead to more contacts because we'll be indoors more often. We know that there's a perception of safety in Gonawage. I showed you some data that demonstrates that we are not necessarily in a safe place right now, meaning that we have an increase in cases. The Delta variant is higher here than anywhere else, so we need to protect ourselves even more so. There's an increased risk, again, as I mentioned, with the Delta variant. Generally, we have low overall vaccination rates. We're starting to hear a little bit about vaccine efficacy lowering after 6 to 12 months. Our vaccines were 3 to 4 months ago, for some 6. So we think that we may have some more breakthrough cases. This is something we're watching for. Again, it's a risk that we're following closely. There's also the threat of the Delta variant that's happening in the regions surrounding us. We know that we are not living in a bubble, that we do use resources outside of the community. Schools will be starting outside of the community. This adds another element of risk. We're also almost at the point where we will be unable to contact trace within 24 to 48 hours. This is a really big risk that will impact us negatively if we don't get a handle on our number of contacts. Just as an aside, we do get some assistance from regional public health for contact tracing purposes. However, I'm going to take that because I can't read. I don't have my glasses. Sorry. So we do have. I wanted to talk about regional services because they are at a point as well where they're unable to assist us with contact tracing. In fact, in many regions already in Quebec, because of the extra resources required for contact tracing for the Delta variant, their contact tracing has already stopped in other regions. We cannot stop that here. It is the cornerstone of keeping ourselves safe. We need to be able to contact trace, and we need reliable, accurate information from you when we call. What else makes us at risk? We know that Gonawage is not like outside families. We know we have many families that live together in one home. We know we see each other on a regular basis. This we want to maintain, but we want to maintain it in a safe way, and it does add an extra element of risk. All of the risk areas that I mentioned have, I guess, lead to increased contacts or the possibility of increased contacts, and therefore we have to implement measures at this point to decrease measures in other ways so that we can continue to live and move forward. So I'm going to summarize a little bit. We gave so much information today, and this is a really important update, and I really urge you to rewatch it as much as possible, especially the first message that was on. As the number of cases increase, our number of contacts will increase. And when that happens, we're going to move from green to yellow to red, and implement measures in order to allow us to safely, effectively move back to the green level as quickly as possible and avoid death. This is what we want to do. We want to, again, keep people in school. We want to keep people out of the hospital. We want to maintain the economy. We want to protect our families and our loved ones as much as we possibly can. And the measures that we are asking to implement during this red and yellow is the proof of vaccination measures in high-risk areas. This is outdoor events and festivals, sports venues, indoor sports events, organized sports, bars, restaurants, social clubs, gaming, indoor recreation areas. We are not going to implement in gyms, as Quebec is doing, because we've evaluated our gyms to be at low risk. They already have existing environmental adaptations. They also have very low members in their buildings at a time. We also will provide strong recommendations to private businesses to implement vaccine mandates for their employees in non-essential, high-risk settings, such as restaurants and gaming. We will have vaccination mandates in certain areas where we work with very vulnerable populations who have a right to safe care. And at certain points during these phases, we may implement and recommend further limitations on gathering, so making your gatherings smaller, learning to gather differently than we used to in the past. And again, as we analyze through contact tracing where our outbreaks are coming from, what the root causes are, we will continue to communicate with you so that you have information about further measures that we may need to temporarily implement to be able to get back to that green. The goal is to not return to lockdown. We want to avoid that as much as possible, because by going into lockdown, we will impact drastically our mental health, our spiritual health, our physical health, the economy, our education. All of these will have long-term consequences on all of our future generations, on our generation now. The pandemic is going to have enough impacts on all of us for many years to come. We do not want to add to that if we can have lower measures that will get us through this period safely. No matter how we feel and the divisiveness that may come from these measures, we cannot ignore the fact that we are at a high level of risk at the present time. Our goal is to protect the whole, to have collective responsibility, to work as a team, whether we're vaccinated, unvaccinated. It's collectivity beyond individualism. It's working as a team as opposed to thinking about ourselves. We want to work together to be able to decrease contacts so that our hospital and our frontline workers can continue to do the job they're meant to do. Our actions, again, are going to directly impact future generations. And we hope that this information gives you a little bit of a snapshot into some of the rationale that we've discussed over the past days and that you'll be hearing about in the days to come. And we'll continue to provide information and charts and links to valid, reliable scientific data so that you can then be informed and make these decisions for yourselves. But what we do ask, whatever the decision is that you make, that we stand together as a community to fight COVID, as Kahsennenhawe mentioned. This is Gonawage against COVID-19, not about anything else. Thank you.